Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about sports injuries, a follow-up show, and joining me again is Dr. Huang. He's assistant professor at the University of Oklahoma School of Community Medicine and Sports Medicine. Welcome, doctor.
Thank you.
Now, we did a part 1 not too long ago, so this is part 2 because I always run out of time. I may revisit a few things for people that may not have watched that show, but I'll probably save that till the end. So what I want to focus with you on is looking at some common sports injuries and prevention, and as well as sort of if something happens, what do you do about it? Sure. Let's start off with one that people may not think a whole lot about. People that do, because that is a sport like ballet, that type of thing. You're up on your tippy toes and stuff like that. Tell us a little bit about that.
Okay. Well, dancing, as you know, is mostly in your lower extremities, and of course when you're a dancer and you're on your toes, of course you're going to be more at risk for toe injuries. You know, all of our toes and fingers have joints in them, and it is very easy to sprain those joints. Okay. So that is definitely one thing that we do see.
Now, with dancers, are there certain kinds of sort of preventative exercises that they should be doing? Because just as the general person, when we think about our toes, I can't think of a toe exercise to do to strengthen my toes, but what should they think about doing in terms of strengthening?
Okay. I don't know that there are specific routines to prevent injury, per se, but certainly dancers are going to be using their toes and their feet more than the rest of us. When somebody does have an injury, such as a sprained joint in their toe, we more treat them with things like rest and footwear more than, say, exercises to strengthen the toe.
Okay. Now, in terms of footwear, that's always very critical in any type of sport that you're engaging in. So to be fitted for the proper type of shoe is really critical. Are there any sort of guidelines? I know sometimes when we think about women just in regular shoes, if the shoe looks good, who cares if your toes are a little bit pinched or something like that? But in athletics, if you're buying a shoe and your toes are kind of pinched in there, that is not a good thing, is it? Should there be a certain distance that your toe can have from the end? Are there some general guidelines you can give us?
Well, it's certainly very important to have a proper fitting shoe. Proper fitting shoe for me is going to be different than it is for you. Nevertheless, going to a store where they fit you properly is very important. Now that said, you know, each of us have a different anatomy, and we have different shaped forefoot, and the width, say, of our foot where our toes hide are going to be different. It's very important to have a proper sized forefoot in the shoe so that you have enough room for the toes. When somebody has a toe injury, such as a sprained toe or even like a turf toe that you would see in soccer or football or from ballet dancing, we generally look for, or we try to recommend a shoe that has a very firm sole. So that way they're not doing a lot of extra bending of those joints. So a stiff-soled shoe, or sometimes if they don't have one, we'll put them in what's called a surgical or post-operative shoe, which is flat on the bottom and prevents those joints from moving too much.
Okay, now you mentioned turf toe, so people may wonder, what is a turf toe? Is that just when the toe gets stuck? But then you mentioned dancers, so what exactly is a turf toe?
Okay. Turf toe really is an injury to the ligaments on the bottom side of the toe joint. Okay. And when that happens, there's inflammation in the joint capsule, and that can be very painful. The way we treat these things is with rest, but it's so hard to rest the toes because we're walking everywhere we go, and that's why, you know, we want to allow the person to ambulate without stressing those joints, and therefore a stiff-soled shoe or a post-op shoe is really appropriate for those injuries.
Now, can you get injuries in these types of sports or sports in general if the shoe is not fitting, where there's rubbing on the sides of the foot or the toes? I mean, can that be problematic?
You can, especially if the shoe is too large. Then your foot would have lots of room to move, and therefore therefore can be subject to friction on the sides, and that's why you don't want a shoe that's too large. You don't want one too small that's squeezing the toes, or any point. You want it to be appropriate fitting.
And I think that's important for people to know, especially with children, because sometimes we may pass down clothing, pass down shoes. You know, this is what your brother or sister played football in or soccer or whatever, so it's about your size, you could wear it. But that's not really the philosophy we should look at, because like you're saying, each foot is going to be a little bit different.
Right. That's very, very wise. Yeah, no matter who you are, you want your shoes to be fitted for you and not for your older brother or your younger sister.
Okay. Now let me ask this in terms of dancers too, just stick with just a moment. You talked about the foot and sort of ankle types of injuries. Can there be injuries like with ACL tears or knee injuries, things, I mean, can it come further up the body as well?
Injuries can certainly be anywhere, especially in the lower extremity. Specifically, ACL type injuries would not necessarily be as common.
Okay.
When we talk about the kinetic chain, meaning that everything is connected, the foot bone is connected to the ankle bone.
I remember there was a song, Doctor,
Right.
The foot bone's connected to the leg bone.
Exactly.
Yeah.
So certainly things are going to be affected. So
Okay.
if the toe has an injury, that can affect things in the ankle or the calf or the knee, but it may not be specifically an ACL tear.
Okay.
And those types of injuries are going to see more where somebody has a quick change of direction on a planted foot in, like, say, soccer or basketball or football. But it doesn't mean it's the only places. It's just that it's more likely to happen there.
Okay, now let's transition then to soccer. So you're saying that more in soccer you have those types of injuries. Do you have as many foot-related injuries in soccer as you do with the knee injuries and things, or how does that look?
Well, in soccer, you're always using the lower extremities again. So knee, ankle, and foot are going to be the primary places for injury. Toes can certainly have injuries from turf toe or from blunt trauma, contusions, from kicking the ball or kicking another player, kicking the ground instead of the ball. So certainly toes and feet are definitely places for injury. Additionally, stress fractures from all the running and pounding on the feet, definitely areas for problems.
Okay, well, we're going to take a really quick break, and I want to come back and talk a little bit about these stress fractures and have you clarify for people what kind of fracture is that.
Sure.
Okay. Please stay with us. We'll be right back.